In 1964, our hospital performed the first kidney transplant in a child in the state of Illinois. Since then, we've performed over 700 kidney transplants in pediatric recipients. Of those, almost half have been from living donors, and almost a third have been preemptive kidney transplants, meaning that the child didn't have to start on kidney dialysis before receiving a kidney transplant. I believe that our program is one of the top for treating end-stage kidney disease in children, because we do have this multidisciplinary team full of experts that have been working in this field for many years and have a lot of experience dealing with rare, complex, genetic, medical, anatomic defects. We have a team that consists of not just kidney doctors and transplant surgeons, but also of dietitians, social workers, urologists, anesthesiologists. So we're really able to address every complex need that our children might have going into kidney transplant.
For the Living Donor program, we work very closely with Northwestern Memorial Hospital. The surgeons there were pioneers in developing laparoscopic kidney donation, which is a very minimally invasive way of removing donor kidneys without a big operation. It's a quicker recovery time. We do about 20 to 25 kidney transplants per year, and we provide vascular access and peritoneal dialysis access to probably 30 or 40 more children a year, so our total volume is quite high.
We also work closely with urologists, which especially in a pediatric population is so important since the majority of the end-stage kidney disease we see comes from urologic abnormalities, some of which might cause problems after transplantation.
Our data shows that up to 25% of our kids have some sort of primary bladder problem, which is directly related to their need for kidney transplantation. In those cases, it's important to ensure that the bladder is a safe environment for accepting a transplant kidney in order to prevent loss of function of that kidney over time. Pediatric urologists are involved throughout the entire process of kidney transplantation, including preoperative evaluation, surgery, and postoperative management. We have a weekly transplant meeting that we are part of and attend. We discuss patients before they're even seen at Lurie Children's Hospital to determine if they may have urologic needs.
We look after the patients sometimes from when they're born in terms of providing peritoneal dialysis or even vascular access to these kids. And then when they reach the appropriate age, we do the transplant operation.
Our program provides holistic care from the very beginning, from pre-transplant. We have a multidisciplinary approach at the evaluation, and we follow them through their day of their actual kidney transplant. From there, they continue to follow up with their other specialists, as well as us, and we become their coordinators or their medical home. Education about kidney transplant is so important. We meet with them for a full day at their evaluation to talk about pre-transplant, what to expect at the time of transplant. That education continues until the day that they go into the OR, and then we meet them in the ICU afterwards and continue that education while they are inpatient after their kidney transplant.
We bring a variety of disciplines to bear on the decisions that affect the individual child. It's not just the surgeons who decide or the nephrologists, but it's also chaplains and the social workers, and obviously all these discussions involve the families to a very high level.
Family-centered care is very important in the care of all patients. We definitely have a focus on the family and involve the family and the patient in their care post-transplant.
We are a compassionate leader in pediatric kidney transplantation because we really do look at each potential recipient and eventual recipient as an individual. We have our protocols that we work from, but we know that each kid is different and has a different cause of their underlying kidney disease, a different family situation, different resources, and we really work hard from the beginning, far before transplant, to try to optimize the situation to increase our chances for success, especially with a child's first transplant, which we hope is going to be the only transplant they need. We're reaching our goal of maximizing outcomes, not just for length of graft life after transplant, but also for the quality of life for the child and their family after transplant and as their life goes on.
My favorite thing about Lurie Children's Hospital is all of the people who work here because they're very nice. My kidney transplant went great, and I can play with my friends and go to school like a normal kid.
Kidney transplant offers our patients just kind of a second chance to be normal kids, and it's really awesome to see that in clinic, see them flourish, meet developmental milestones, and get to participate in normal activities. That's kind of where we get our joy after kidney transplant, is seeing our kids participate in normal things.